Good morning to one and all. Today's lecture topic is the complete cast metal crown preparation. Okay, so coming to the advantages, guys, first of all, the advantages are because all axial surface of the tooth are involved in the preparation, a complete cast crown has greater retention than a conventional restoration, right? So a crown will definitely be more retentive, right? Okay, normally a cast crown preparation also has greater resistance form than the partial coverage restoration of the same teeth. We have talked about principles of tooth preparation, right? And we have learned that full coverage crowns, full veneer crowns do have better retention, resistance. The strength of the complete cast crown is superior than the other restorations, right? Because it encircles the whole teeth and it has the corrugations on the occlusal surface, so it is more superior strength-wise as well. Okay, coming to the fourth point, a complete cast crown allows the operator to modify axial tooth contour, right, which is significant and it can help us to align the malaligned teeth. Okay, although the extent of possible recontouring is limited to the periodontal considerations. Okay. When special requirements exist for axial contours, such as when retainers are needed for partial removable denture, that is the CPD, guys, the cast partial dentures, right? The complete crown is often the only restoration that allows necessary modifications for the creation of either rest, guide planes, or survey lines, guys. Yeah, shaped survey lines. So you can see that occlusal rest has been created on the premolars, guys. Yeah. And this is in such cases easier to do, guys. Yes, we try and avoid not to give it on the crowns, but yes, it is more easier to do. Yeah. So seen in this photograph. Okay, and you can see that the occlusion is also proper. Okay, the restoration permits easy modification of the occlusion, right? Which is often difficult to accomplish in other type of restorations, right? Okay. Coming to the disadvantages, because all coronal surfaces are involved in the preparation for complete cast crown, removal of tooth structures extensive, right? And definitely it gives adverse effects to the pulp and periodontium, right? Because of the proximity of the margin to the gingiva, it is not uncommon to see gingival inflammation. So yes, gingival inflammation can be seen. Okay, and after cementation, it is no longer feasible to perform electric vitality testing of the abutment teeth. Yeah, the conductivity of metal interferes with the test, guys. Right. So for future complications, um, yes, the thermal tests occasionally yields information. Otherwise, you'll have to just see it in an IOP or cut and remove the crown. Yeah. Another disadvantage is that patient may object to the display of metal associated with complete cast crown, especially in the normal smile line, right? So it should be restricted to the posterior teeth, where usually we are not able to see um, normally, guys. Okay, coming to the indications. So the complete cast crown is indicated on teeth that exhibit extensive coronal destruction where caries or trauma. So it is indicated in those places. It is the choice of restoration whenever maximum retention resistance is required. Okay, again going back to the principles of tooth preparation that we already covered. On short clinical grounds or when high displacement forces are anticipated, also this works well. Also, it can be fabricated when correction of axial contours is not feasible with more conservative techniques. Okay. Coming to more indications, the restorations also may be used to support partial removal denture like you just saw. Okay. in the earlier photo, the minimal dimension required for occlusal rest for partial removal dental prosthetic framework necessitates removing significant amount of enamel if the dentine is exposed, restoring the tooth with the cast crown. Okay, so that is also um, uh, one of the other points. Yeah, one of the other indications, guys. Yeah. Uh, Coming to the last indication, it is of course indicated endodontically treated teeth. Its superior strength compensates for the loss of teeth structure that results from previous restoration or carious lesions and endodontic access. Okay. Coming to the contraindications, it is contraindicated uh, if treatment objectives can be met with more conservative restorations. Okay, so if a better restoration can be done, a better crown like porcelain fused metal or all ceramic, they should always be preferred. Wherever an intact buccal or lingual wall exists, um, use of partial coverage restoration should be considered, right? So wherever these wall exists, we should not be using this full coverage crown. In particular, if less than maximum retention resistance are needed, a preparation more conservative to tooth structure is called for. Similarly, if an adequate buccal contour exists or can be obtained from enamel modification, enameloplasty, this is not indicated this crown, okay? If a high aesthetic need exists, especially in tears, it is definitely contraindicated, guys. Yeah, it's a metal, guys. Okay. So now coming to the criteria of preparation, guys. The occlusal reduction must allow adequate room for restorative material from which the cast crown is to be fabricated. Okay. Minimum recommendation clearance for non-functional, non-centric cusp is 1 mm, and for functional or centric cusp is 1.5 mm. The occlusal reduction should follow normal anatomic contours to remain as conservative as of tooth structure as possible. Okay. Axial reduction should be parallel to the long axis of the tooth, but should allow a recommended 6-degree taper or convergence. Okay. The margin should be chamfer configuration, right? This is important, guys. Should be located supragingivally, right? Or in the case we teach you, equigingivally. Okay. The chamfer should be smooth and distinct and allow for approximate 0.5 mm of metal thickness at the margin, right? Okay, coming to beveling and margins. So you have a functional cusp bevel and non-functional cusp bevel. At least 1.5 mm of occlusal clearance should be given, and the beveling has to be done at an angle of 45 degrees. Okay, non-functional, non-centric cusp bevel, a minimum of 0.6 mm of clearance is needed here for adequate strength. Okay, and the margin is chamfer configuration, right? So it should have 0.5 mm in developing the optimum axial contour. Okay, so here you can see the functional cusp buckle of the mandibular, okay, and lingual of the maxillary, the palatal of the maxillary, right? So 1.5 here, guys, 1.5 here because it's functional, non-functional cusp 1 mm, 1 mm, margin is 0.5 mm, okay? Preparation. The clinical procedure to prepare a tooth for the complete cast crown consists of following steps: occlusal guiding grooves, occlusal reduction, axial alignment grooves, axial reduction, finishing, and evaluation, guys. Okay, and first we'll discuss the armor material. Okay, so usually you're using the tapered carbide burr, right? Shown here in the photo, or diamond, and narrow and round tipped. This is the narrow and round tipped, guys. Okay, used for grooves, additional retention, occlusal reduction, wide, round tipped, tapered diamond, right? This is the fine grit, guys, okay? Fine grit is the yellow members, okay? This is for finishing, okay? Not given in the photo. Utility wax, wax caliper if required for occlusal clearance, right? High or lower speed contra angle handpieces, okay? So these are the burrs, right? Okay, so basically the same thing, yeah. Okay. To ensure that the centric or functional cusp will be protected by an adequate thickness of metal, place the functional cusp bevel in the area of contact with the opposing teeth. Okay? So at the area of contact you're supposed to place. The depth of the guiding groove should be slightly less than 1.5 mm. Why? Because when you merge the grooves, it should look even, guys. Okay? Use of guiding grooves to ensure that occlusion reduction follows anatomical configuration. So the anatomy of the teeth has to be preserved, right? It has to be reduced. Again, I'm repeating, guys, but it has to look a miniature form of the same big teeth. A groove should be placed in the low point and the high point of the cusp, right? So in two angulations, guys, right? Um, so the points then can be connected well. Okay, correct depth is 0.8 mm for the central groove and non-functional cusp, and 1.3 mm for the functional cusp. Okay, coming to the occlusal reduction, complete the occlusal reduction in two steps by a carbide or a narrow round and tapered diamond. Have the occlusion surface is reduced first and the other one is maintained for reference, guys. So that is the actual standard way of doing it. Okay. On completion, it can be checked. Sorry. Um, it can be checked for minimum clearance on 1.5 mm on functional cusp and 1 mm on non-functional cusp. Okay. The patient should be told to close this layer of utility wax in intercuspation. So I'll just be showing you a photograph. Okay. Place the wax back in the patient's mouth. Tell the patient to bite. On removal, thickness of the utility wax is again measured, and then you can see if there's clearance or not. Okay, so usually it should not perforate. If it perforates, that means there's no clearance. Okay, so there, you prepare half and you leave half, and then you join it so you have a reference point, guys. Okay, that's how you ideally standardly do it. There are more methods to do it, guys. Um, Again, you can note the angulation, so all the cusp and the grooves are not flattened, guys. Yeah, so they're actually letting the anatomy remain, guys. Okay, so you tell the patient to bite on the wax, and then you can see that there's no perforation. That means the clearance is sufficient, guys. There are wax calipers that you can measure from, but otherwise we can see um, a clearance. Okay. Alignment grooves for axial reduction. After the occlusion reduction is completed, three alignment grooves are placed in each buccal and lingual wall with a narrow, round, and tapered diamond. One is placed in the center of the wall and one each on mesial and distal transitional line angle. Okay, so when these guiding grooves are placed, um, they should be placed such that there are 6-degree taper, guys. Okay, do not let the diamond burr cut into the tooth beyond the point where the tip is buried, otherwise will lead to over reduction and unsupported tooth enamel, right, guys? So gingivally, the resulting depth of the alignment groove should be no more than one half the width of the tip of the diamond. Okay, guys? I'll be showing you photos in the coming slides. The alignment grooves determine the path of placement of the restoration. Okay, so it should be, guys. Okay, so you can see these are the alignment grooves for the axial reduction. Okay, so this is how you place grooves, guys, right? On the buccal and the lingual surface, and then you can reduce, guys, right? Okay. um this is just showing clinically the same thing, guys. Okay, so that's how you do it, and then you know how much to reduce, guys. You're not supposed to take the whole structure out, guys, right? Okay. Axial reduction, The technique for axial reduction is similar to that of occlusal reduction. The remaining island of tooth structure between the um, alignment grooves are removed while the chamfer margin is being placed, okay? And the same narrow, round, and tapered is used for the procedure, okay? As with the occlusal reduction, perform the axial reduction for half the tooth at a time and maintain the other half for reference, okay? So once you make the grooves, do the reduction, guys, okay? So now this step is known as axial reduction. We have merged that, okay? And we have kept one point as reference. All right, and this is what it's showing in the patient's one. There, guys, okay? The same thing in the patient's one. Cut into the proximal area of both the sides until only a few of the interproximal island remains. This area can be removed and broken contact by thinner tapered diamond, right? So a thinner tapered diamond can be used, a needle shaped burr can be used, and then the unsupported enamel can be just broken out by the probe like we have showed you in the demos. Yeah. Sorry, guys. Um, place the cervical chamfer concurrently with axial reduction, okay? So its width is approximately 0.5 mm, right? So it has adequate bulk of metal at the margin, okay? Also, the chamfer must be continuous and smooth, guys, all over. Right. Also, you can see the thickness of the chamfer margin, guys, all around. Yeah. Okay. Yeah. Okay. Coming to the last few slides, guys. Finishing has to be done obviously with the smooth, continuous. The preparation has to be smooth and continuous, guys, so it will be easy for impression making, wax investment, casting, fabrication. So these are the lab procedures. Once you send the preparation to the lab, the lab does these procedures, right? Life will be easier for them as well. So use of a fine grit diamond or carbide burr of slightly greater diameter for finishing the chamfer can be used. Yeah. Okay. So as you can see in the photo that the lingual and the occlusal surface are being finished. Okay, so this is basically a polishing where all the line angles, point angles have to be round, nothing can be flat, everything has to be intact, guys, and contact has to be broken, margin has to be clear, it has to be at the correct location, the margin, all the irregularities have to be removed. Okay, so the crown prep is complete, and yes, it was probably a carious teeth which was restored, and then uh, the crown preparation was done, guys. Okay. Okay, so we finish all the prepared surfaces and round off all the line angles. A wider diamond is recommended for smoothing out the unwanted ripples on the axial reduction and which eliminates any unsupported enamel at the margin. Okay, so placement of any retentive features, grooves, or boxes, if you want, can be done. So here is example of groups which are just created there, guys, on top of the prepared structures. So we do have a more proper retention of the crown, guys. Okay. All right. Okay, so guys, that's all, and this is a completed preparation which is characterized by a smooth, even chamfer and 6-degree taper and gradual transition between all the prepared surfaces. Okay, so you can see the beveling, guys, at 45-degree angle. You can appreciate all of that. Okay. Okay, guys, this is the bibliography. Um, Schillenberg and Rosenstiel remain the standard textbooks, guys. This is from Rosenstiel, guys, so you can also refer to Schillenberg. And for any further questions, please come and see me. Yeah, thank you.